U.S. Senator exploring a run for president, but Rand Paul is also a practicing eye doctor. And this morning, he's in Louisville performing pro bono surgery. Rand Paul joined Louisville ophthalmologist Dr. Frank Burns during cataract surgery on 3 patients who could not afford to pay. Paul also heads to Guatemala this weekend to do work for a medical charity there. WDRB asked Paul what gives him more satisfaction, politics or medicine.
It's a lot different. This is more immediate in the sense that you diagnose a problem and then you fix it, and most people do see better. In politics, I think sometimes we diagnose the problem correctly, but sometimes we misapply and give the wrong solution, or sometimes we give no solution at all.
Paul is scheduled to speak at a Greater Louisville Inc. luncheon later this afternoon.
Well, most of us know him best as a politician, a senator. Senator Rand Paul is actually an eye surgeon by trade, and today he went back to his old passion. WHAS 11's WHAS has been watching him perform eye surgeries, and she joins us in the newsroom. Brooke?
Kelsey, definitely not for the queasy. We were in the operating room as Dr. Paul performed one of several cataract surgeries to patients who otherwise wouldn't receive this type of care. Paul spent almost 20 years practicing medicine around Bowling Green, Kentucky before running for the Senate seat in 2010, but sometimes he can't help returning to his roots when he has the chance. It became his passion years before he ever stepped onto the Senate floor. Tuesday, Senator Rand Paul put on his scrubs and, if only for an hour or so, stepped into the role of an eye surgeon, a title he's managed to hold for decades even after entering into politics.
It's a way for me to get back into surgery and also hopefully do some good at the same time.
Paul sold his practice several years ago after winning the Senate seat, but he still takes time during August recess to help those in need, free of charge.
I'm seeing this every day. Patients come in, they can't pay for surgery, they can't pay for their office visits because they have these deductibles that are just ridiculous now.
He joined Dr. Frank Burns at the DuPont Surgery Center in St. Matthews, where together they performed several pro bono cataract surgeries.
I go to Washington to talk about issues, and we end up talking about cataract surgery, which is kind of fun because he doesn't get to talk about it very often.
Paul will take his trade to Guatemala in the coming weeks, a first for him as an eye surgeon. He's previously helped kids from the area who came to Kentucky for his care.
So we're going to meet with them, re-examine their eyes, and see how well they're doing.
We asked which he'd prefer if he could only choose one of his 2 passions, politics or optics.
Is that a trick question? It's a lot different. This is more immediate in the sense that you diagnose a problem and then you fix it, and most people do see better. In politics, I think sometimes we diagnose the problem correctly, but sometimes we misapply and give the wrong solution. And this is a chance to actually, really, we know what we need to do, and now we just have to accomplish that task. And then most people get better vision after this.
As for Paul's medical mission overseas, he will team up with eye surgeons, nurses, and technicians from the University of Utah, where he'll perform more than a dozen eye surgeries for the locals there. In the newsroom, Brooke Hash, WHAS 11 News.